Peggy Webster. I'm a housing person.
Chief McCurran
Current Wilson Fire Rescue.
and Greg.
Greg Brotherton, County Commissioner.
Brian.
Hey, good morning. Brian Tracer with East Jefferson Fire. I'm filling in for Chief Black today as he's taking a day off.
Thanks for coming in, Brian. Jolene.
Jolene Crone, Deputy Administrator, Clinical Director with the Salish Behavioral Health Administrative Services Organization.
You're speaking fast too, Jolene. Thank you.
It's a long title. You see how I have it down. It just rolls off my tongue now.
Patrick.
Yes, Patrick Johnson with the National Alliance on Mental Illness, Jefferson County affiliate.
And Alyssa.
Alyssa Rodriguez, Administrative Assistant, Jefferson Healthcare.
All right. Thank you all for joining us. Lori, if you could go ahead and pull the PowerPoint up. So this is our agenda for today's meeting. Quick introduction and updates. We're going to spend most of our time looking at the strategic framework and trying to make some updates to that. And then at the end, I want to talk a little bit about how we're trying to get that strategic framework completed and what the time frame for completing that is. Before we start on the strategic framework discussion, other than what you heard at the last meeting, are there any updates relative to the working age band that anyone in this group would like to make? Greg, I might ask you if it's okay. In a previous meeting, we had just a little bit of a discussion about the kind of CARES funding part 2 and how that might go. Can you take just a second and tell us what's going on with that?
Sure. We got Treasury guidance just in the last couple of days. There's a lot of flexibility, public health, economic recovery, housing, all of these things that we're considering are pretty much covered. We don't have a process yet. We've kind of been waiting for that Treasury. I think we're going to talk a lot about it at our Monday the 17th meeting. And, we still have an intent to make some big projects with it. It looks like, I think, depending on unemployment rate in the county, we might be able to get all $3 million up front. And we do also likely will have a significant revenue from some ancillary payment in lieu of taxes revenue that comes in. We're still looking at, I'm really pushing this kind of system of care, housing hub, shelter concept. And on Monday, we're going to be considering as a commission a letter of intent on a specific property. And then I'm going to be going to the city council and presenting with them about it as well. And this is a project working with the shelter committee from the housing task force on really setting up the criteria and trying to get input from all the different service agencies and housing providers in the area to really get as many ideas as possible as we plan it. But the idea would be maybe purchasing property with this with the rescue plan dollars.
Yeah, Patrick, go ahead.
Yeah, building what Greg said, the legislative session is over and it was quite successful insofar as behavioral health is concerned. Some law enforcement reform issues, housing money, the creation of the statewide ombudsman office, and a host of other things. And then Lori sent out an update about the Blake decision, some things that were attended to. So the legislative session was quite successful, and perhaps at some point, this may have been done already, but at some point we could get an update on that. So everybody that worked on that, thank you very much.
All right, and Lori did paste in the chat some additional information about that funding. So if you get a chance, take a look at that. All right, so we're going to go back to the discussion about the strategic framework. And I just want to give you, this is kind of at the end of the agenda, but I'm just going to pull it up now and let you know that the time frame for this is we're trying to have this framework completed by August, which is a pretty tight turnaround. And the reason is, well, there's a couple of reasons. One is I'm retiring in August, and so I will no longer be able to facilitate. Lori spends the majority of her time on the HRSA grant, and so that makes, kind of continuing the work of these age band groups to be challenging for our small little CHIP FTE. We're not sure yet how, my position is going to be replaced by the hospital or the health department, or how that's all going to happen. And, I think I have a big investment in the work that's been done, and I want to try to see it as much as I can to its conclusion. The plan would be that, sorry, Lori, I'm going a little bit off agenda, but it's probably better to do this now. The plan would be that we would complete the frameworks, and Lori and I would be working on kind of the core content of the CHIP plan, which has two components. It has kind of an overview of the community as it exists, and then the strategic frameworks, and try to complete a draft of that before I leave and present it to the joint boards. After those boards meet, we would reconstitute a working age band and invite all of you to participate and see if there's others that we would need to try to do the implementation part of the plan. So that's kind of an overview. And if there's a sense of urgency from me, I think you probably can see now why we're trying to get as much of this strategic framework put together as possible before August. And that means we basically have 4 more meetings to kind of finish that work. So with that.
Can I ask a question?
Yeah.
Given the short time frame, I don't know, I do meetings all day long, but do you want to think about asking the group if we might want to do hour-long meetings for the next couple, so we might be able to get through this?
Yeah, I think there's a few strategies we might employ. One of the things that I am definitely going to employ is to try to get people to do a little bit of homework between meetings, so that a lot of this work is kind of fine-tuning this strategic framework. That's the main task that this group has to complete. And at the end of this meeting, Lori and I will update that strategic framework, send it back out to you, and ask you to start filling in things that you feel like are critical, and provide more detail for some of the things that are on there. And Greg, I'd say depending on how that goes, we might add extra meetings, we might lengthen these meetings. If everything goes great, we might just continue on the schedule that we're on, but I think we'll kind of assess. And I think we have enough experience that we won't end up at the end having an 8-hour meeting to try to jam everything in there. So that's kind of the overview. Okay, Lori, I think we can go back to the slides. Lori, you're doing a masterful job, by the way, of switching back and forth between slides and letting us talk some. So at the last meeting, there were some pieces that we identified that might need some additional work in the framework. One was kind of looking at how to parse through the data about mental health incidents in our community. And Chief Black was going to provide some information and some insight into that. And Brian, I'm not sure if he spent any time with you, but we did get some data about the mental health incidents in our community. And I think for those of you that are on the front lines, I'm certain they're not going to see anything too surprising in this sheet. Questions or comments about that?
Did Brian leave the call?
No, he's still here.
I wondered if he had anything he wanted to speak on with regard to the mental health incidents.
Yeah, so just briefly, Chief Black and I, he spoke to you guys about one incident we had last week, which I was on with him. My previous background, I spent 21 years as a deputy with the sheriff's office and retired as their chief deputy. So I'm well aware of how police, law enforcement have to deal with mental health issues. And then more so now being on the fire side and trying to work with police to find a means in which to protect those people suffering from some kind of rage, aggression, or delirium. And it's that line between what RCW law dictates law can do and how best to support someone that's going through a crisis that's truly sick. And I'm finding, and I've brought this to the attention of both Chief Black and our medical programs director going, okay, we need to do something different, because in the last 4 or 5 years, the amount of mental illness that we've had to deal with on the fire side with interaction with law has increased. And then, you know, with society being the way it is and law enforcement being kind of, I don't want to say hamstrung, but they're limited in what they can do. It's starting to affect and roll over into the EMS world. I heard, for example, the other day that the new definition for mental health is a medical issue. Well, that doesn't quite translate into emergency medical services and what my paramedics do. So there needs to be a reevaluation of what some definitions are, and then what roles we, not only EMS, but law and psychologists and mental health professionals play together. So coming together to reevaluate kind of how we are going to support someone that's in true crisis. So sorry for the blah, but yeah, Chief Black and I have been working on this quite a bit, and we're going to continue to work on this just to make sure that the people that we have to deal with that are truly sick get the appropriate help that they need, and that we professionals, everybody here, can do it so there's less liability when we do it, and if we're doing it the right way. So that's my whole goal, is to try and make sure we're doing stuff the right way for the right reasons, so that people can get the appropriate help they need when they need it. So it's kind of where that was going. So yeah, I'm a little bit versed in it.
Thanks, Brian. I think that was a really, really good perspective and an important message to communicate to the group. And I think just to kind of translate that, you know, the mental health piece into the strategic framework that we've been working on. Previously, when we've looked at issues for, you know, what are the most important issues going on in the community in terms of health, mental health always is at the top of the list. And one of the reasons we picked this group out of the Behavioral Health Coalition was that we recognize that a lot of what we need to work on are mental health issues for working age in our community. So as you look at the framework, we just want to make sure that you translate those priorities into the information that's on that framework. And Lori, I think we can go back to the slides again.
As I'm doing that, one of the things I wondered if we wanted to mention was how this same thing impacts at the elder age group that we were just talking to this morning. And the idea that maybe some of the work we're doing in different frameworks will actually address this one issue, but we won't have a framework in every age group to address it, if that makes sense.
Yeah, I mean, I think that mental health is actually a pretty high issue in all three, the, you know, youth age band, working age, and elderly age band. And I think it's clearly a high priority for our community. And I think at some point we may want to have all three of the age bands talk about where there's overlap on the mental health front. So the other topic that was brought up at the last meeting that we haven't really had a whole lot of time to address, and I don't think it's in any of the frameworks right now, is the issue of transportation. And I think it's particularly related to like when we have somebody with substance use disorder and the only inpatient treatment that they can get is in Spokane. And Brian, I'm sure you're familiar with this. That means you guys are out of the county for a full day, basically taking them over and bringing them back. And there are not a lot of other resources in the community for transporting those people. And so there's some hope that we'll spend some time trying to resolve that issue and look at what other resources might be available for transporting patients to inpatient treatment for mental health or substance use disorder. And then, Lori, I think we're kind of down to where there have been some work being done on the strategic framework. So Peggy Webster, I know that you sent us some information about sort of focused on housing, because I know that's your main area of focus. And I'm wondering if you are willing to take a few minutes to explain what you put in this piece of the framework.
Sure. The goal is around the improving the social determinants of health factors, and one objective is increasing capacity of transitional supportive housing. And there are efforts underway. There's Bayside's doing stuff and Pfeiffer House, and just to kind of make sure we're connected to that and we're working together and know what that is. We did have an objective in about working with DBH to look at getting a planning grant, but the city wasn't able to be the applicant at this point in time. So we dropped that one out. And then we kind of put in, instead of increasing the units of workforce rental housing, that there are many organizations focused on the lowest income, homeless, people under 30% AMI, 50% AMI. Most of the commerce money focuses there also. And then in terms of workforce housing, you have Habitat on the home ownership side, but there really doesn't appear to be a group that's focused on the rental housing for the workforce, for the 80% to 100% AMI. And just putting in an objective to kind of study that and figure out, what's the best way, how can we identify it, finance it, etc. We do know that there's a 0% vacancy rate on rental. So it would appear there is a problem. And if you ever look at Nextdoor, every other day somebody's looking for a rental to live in. So anyway, so that's in there. And then I guess the last one was addressing poverty as a factor in substance abuse, and going to the issue of giving especially the local folks, the local kids, training and skills and training to be able to have jobs that are that pay more than minimum wage, and give them something to hold on to, and working on that kind of thing. And there are some grant opportunities in that regard, et cetera. So those were the kind of the three we came up with. This is a first draft, throw it on the table, people can react, say whatever. But that's it.
Peggy, I just want to relate some of what you said back to the community health assessment, which shows that, basically the age distribution of our community is significantly weighted towards the elderly in our community. I mean, severely weighted towards that. We're the oldest county in Washington State, the 6th oldest in the United States. And I know that multiple surveys have identified that one of the reasons there are not very many working age adults in our community is housing. So I think, the data just underscores for me the importance of, I think it was that second objective about, providing more housing for working age poor. I mean, that's basically what we're talking,
Yeah.
The wealthy don't have a problem, but the working poor, kind of do.
And I wouldn't even say maybe not poor. I'm talking
Yeah.
nurses and teachers, and and you're right. And a community isn't going to survive very long being the oldest. because eventually those folks move on. And if you don't have people coming in, you're going to
Yeah.
have a very odd situation. You're not going to have people.
And we're a tax migration haven too. So we have new elderly coming in at a very high rate still. So I'm afraid the situation can get worse and worse. And I think that second goal is really important. And I think workforce is less specific than 80 to 100% of AMI. And I think that is an area that is really
But
not.
we could make it specific, because in my mind, workforce is 80 to 100% AMI.
Yeah,
So
when I
put
see
that
this
in.
Hendricks, I think 50% of AMI is, restaurant workers and service workers. So I agree with the goal. I think phrasing it a specific
Okay.
AMI range might be helpful just to identify it. I'm wondering if that new apartment building going in on Rainier is going to address it, 36 units. And then
It's going to be market rate.
okay.
right?
Well, I mean, market
So-
rate is workforce housing if it's an apartment rental, right?
Yeah, it depends. I mean, it's not going to get to the 80%, but it might get to, yeah.
And then a stunning number I heard from my area on the area agency on aging board that I'm on is that $58 million a year in the 4-county Olympic Peninsula region goes into in-home healthcare. I mean, that's a huge part of our workforce. It's a huge part of the of the jobs that are here. And I think continuing to look at that kind of fostering housing inside of existing housing, I'd love to see if we could figure that in. I mean, we have so many large houses in Port Townsend that have 2 or 1 person in them that are underutilized, that if we can get that cultural shift to get a second generation into that house, it would really address both the issue of people wanting to age independently, and there's a lot of resistance to going into nursing homes right now, while also create, opening up this new market that has been inaccessible for a long time, culturally inaccessible.
Yeah. I think that sounds like great stuff to put in there, because I think there is interest in the community in tackling this very specific area, the 80 to 100%, because that's where people are. There's a lot of focus on the others. Let's not get involved. They're doing their thing. Don't mess it up. Just let's focus where there's no one's focused right now.
In the sake of time, Patrick, I'm going to let you comment, and then I'm going to move us on. There's one more of these to look at that Jolene worked on. So go ahead, Patrick.
Very quickly, I'm really glad to see poverty as a factor there. And that's the key to all of this. If you're poor, you can't do anything in terms of housing, even if it's available. So that here it relates to substance abuse, but poverty is at the root of a lot of these issues.
And we may be able to broaden that, Patrick, so it's not specifically tied to substance use disorder. And I think that may be more appropriate. So
I think that would be wise. Thank you.
Yeah, we'll kind of take that under advisement. Lori, yep, thank you. Didn't even have to tell you. So Jolene also worked on a kind of a second part of the strategic framework, and it's around looking at the services that people in our community need. And Jolene, I'm wondering if you would kind of do the same thing that Peggy just did.
I will do my best. I haven't looked at this in a couple of months. And nobody gave me a heads up that I was going to have to do this again. I did it last time.
Sorry.
And nothing has changed, Jolene. If everybody remembers.
I was like, you're trying to rely on my memory, and I was just on vacation last week, so memory is not so good.
Since you have talked about it before, if you just want to point out kind of the highlights, maybe at the strategy level.
Yeah, really breaking down the current structure, looking at what resources that we have in place, where the gaps are, being able to identify cross-system resources, and a big piece of that is language, how folks are identified. I know we've had some conversations even just about data, like what does mental health mean, formal diagnosis, not formal diagnosis, those kinds of things, how we all would share an understanding of what that meant. across, crisis services, law enforcement, those other programs. And then looking at, just trying to, it moved. So performing an assessment, yeah, and the transportation piece, we definitely have some issues around that, but this looks different from what I recall.
I think we might have integrated some of the comments that were made at the last meeting. So,
all right, that makes sense.
Good enough. Thanks, Jolene. I'm sorry to spring that on you. So, in the sake of time, we have 3 minutes left. So, as I mentioned, what Lori and I are intending to do is update these frameworks based on the comments that we hear today, send that out to you. And our hope is that between now and a month from now that when we meet again, if you would take some time to look at what's in the framework and add any detail that you want, add anything that's missing that you think is, not important for the working age band and not in the plan. And then at the next meeting, we'll have kind of an updated framework to work from. And, I think by the next meeting, we should be at the point that we are completing our goals and strategies and really are starting to look at the level of activities to try to determine what it is that we want to try to accomplish in the next. I mean, the last CHIP plan was good for about 3 or 4 years, and I would see that as being kind of a target that it's a 3 to 4 year window. If we don't get a lot of feedback, then Greg, I think we will have to go to Plan B where we have more meetings. But if we do get a lot of feedback, hopefully that'll allow us to kind of keep up with the pace that we've been going. So, questions, comments? Does that seem reasonable to folks? Kind of at least one thumbs up there. Yep, couple. Okay, good. So we'll send those out. Take an opportunity to take a look at those. Next meeting, Lori, do you have the date up there that you could shout out to everybody?
Yes, I do. And it is June 10th, 4 p.m. One of the things that I wanted to say, John, is the challenge around the mental health part that Chief Black was talking animatedly about last time, and he wasn't here this time, so I don't know. He had sent me an email with a couple of ideas around what he wanted to do there. And then as we were in the senior meeting, I wondered if maybe some of what he was talking about there should go in the senior framework. But I think that's something, Brian, that we really want to work out with Chief Black, because it will require, I think, a crossover between not just EMS, but also maybe law enforcement. So that's something that I'd like to set the expectation. We'd like to get together with you guys and sort of iron that out.
Brian, do you think we could meet with you and Chief Black? I mean, I think you bring the law enforcement, understanding. I'm sure Chief Black understands that stuff as well, but I think it might be nice for us Lori and I, to meet with the two of you in between now and the next meeting, if you'd be amenable to that.
Yeah, always. And, with that, I think someone had mentioned bringing in possibly someone from the police department and then again, someone from the sheriff's department. I've been out of it for about 8 years, and I know the trends and how things are done have changed. So it'd be nice to get a newer perspective on how that works. And I think that ties into our aged community, if you will. Those folks that have a hard time caring for themselves, but they don't realize they're having a hard time caring for themselves. The tough thing there is, at what point do they lose their right to, say what they want to do. So it kind of ties in, and law enforcement being being the only conduit to taking somebody's liberty based on some criteria. It'd be nice to have their perspective and how this plays out.
Well, Sheriff Knoll just moved into the elderly group, so we probably can't have him join us, but no, just joking.
You just did have a birthday too yesterday, so.
He pointed that out to us at an earlier meeting, so. All right, well, thank you all for all of your hard work, and we're excited to, kind of move this along and be getting to a point that it's, really starting to take some shape. And Jolene and Peggy, thanks to you for putting some thought and effort into that. And we're hoping that everybody else will take some time to do that as well. So, All right, we'll see you guys in a month.